Welcome to the CPHIMS Exam Preparation Podcast. In this episode, we'll explore how to implement and monitor compliance with internal controls to protect resources and ensure availability, confidentiality, and integrity during testing, for example, security audits, versioning control, change control. Implementing and monitoring compliance with internal controls is a critical aspect of managing healthcare information systems, especially during the testing phase where the system is vulnerable to new risks. These controls are essential for maintaining the security, reliability, and compliance of the system. Here's a deeper look into the strategies and benefits involved. Strategies for implementing and monitoring compliance. Security audits. Regular schedule. Establish a regular schedule for conducting security audits, ensuring that they cover all aspects of the system, including hardware, software, networks, and data. External and internal audits. Utilize both external auditors for an unbiased assessment and internal teams for ongoing security evaluations. This combination provides comprehensive coverage of potential vulnerabilities. Remediation plan. Develop and implement a remediation plan for any vulnerabilities identified during the audits, prioritizing fixes based on the severity of the risk. Versioning control. Versioning control system. Implement a robust versioning control system, such as Git, to manage and track all changes made to the codebase. This system should be integrated into the development workflow. Access control. Restrict access to the versioning control system, ensuring that only authorized personnel can make changes to the codebase. Audit trails. Utilize the versioning control system to maintain audit trails of all changes, including who made the change, what was changed, and why the change was made. This documentation is vital for tracing issues and understanding the evolution of the system. Change control processes. Formal procedure. Establish a formal change control procedure that outlines how changes are proposed, reviewed, approved, and implemented. This procedure should include criteria for evaluating the impact of proposed changes. Change Advisory Board, CAB. Form a change advisory board comprising representatives from IT, clinical departments, and compliance to review and approve changes. This board ensures that changes are evaluated from multiple perspectives. Documentation and communication. Ensure that all approved changes are thoroughly documented and communicated to relevant stakeholders before implementation. This documentation should include the rationale for the change and any potential impacts on system users. Benefits of implementing and monitoring compliance. Resource protection. Enhanced security measures. Regular security audits and strict versioning control protect the system against unauthorized access and potential vulnerabilities, safeguarding sensitive patient data and system integrity. Data availability and integrity. Implementing these internal controls ensures that data is available when needed and remains accurate and unaltered, which is critical for patient care and operational decision-making. Compliance assurance. Regulatory adherence. By rigorously monitoring compliance with internal controls, healthcare organizations can ensure their systems comply with relevant healthcare regulations, such as HIPAA in the U.S., which governs the security and privacy of patient information. Reduce legal and financial risks. Compliance with established standards and regulations reduces the risk of legal challenges, financial penalties, and reputational damage that can result from data breaches or compliance failures. Implementing compliance practices. Successfully implementing and monitoring compliance with internal controls requires a culture of security and compliance within the organization. It involves continuous education and training for staff, regular updates to policies and procedures to reflect changes in the regulatory landscape, and investment in tools and technologies that support compliance efforts. In summary, by establishing and adhering to rigorous internal controls, healthcare organizations can protect their information systems and data from threats, ensure system reliability, and maintain compliance with critical regulatory standards, thereby supporting the overall mission of delivering safe and effective patient care. If you found this content valuable, please like, share, and subscribe to Professional Certifications channel.